everyone. So welcome to our presentation. It's called Healthcare Associated Infections. We decided to pick this topic from Healthy People 2020 because it's currently a major problem in the healthcare field. It causes numerous deaths per year. It costs millions and millions of dollars to treat people with healthcare associated infections, and they're completely preventable. So it's really, really important that we increase awareness among nurses and other people in the healthcare team, because it continues to remain a huge problem in society. Okay, so this is Courtney, by the way. So here we put in, this is the death toll. The current death toll is 1.7 million people per year will die from a healthcare-associated infection, which is more than the number of deaths from breast and prostate cancer. So clearly this is a humongous issue. Found this little picture, and there's some other interesting facts. Your length of stay in the hospital increases by 17.6 days if you get an HAI. So it costs so much money to get a room in a hospital just for normal treatments. So here you're having an additional thing that you didn't come to the hospital for. So another one is that HAIs cost $35 billion per year. So I said millions before, but it's actually billions. And here we have $1,100 per admission. So that's a lot of money. And if you're admitted to a hospital, you have a 5% chance of contracting an HAI, which may not seem like a lot, but it really is when you think about it, because this is preventable. It shouldn't happen in the first place. Here are some HAI facts. The first one is healthcare-associated infections are also known as nosocomial infections. They are infections that are acquired in the hospital by a patient who is admitted for a different cause, which I had previously mentioned, that a lot of the time they come for something different, and then due to, I guess I want to say, negligence on the healthcare team, or breaks in sterile techniques and other ways can cause these HAIs. They can either occur during a patient's hospitalization or after they've been discharged. So, for example, they came in to have a surgery done where they needed to have a catheter, urinary catheter, and then after they get home, they start to experiencing signs and symptoms of a UTI, like burning of the urine, flank pain, and then have to go back to the hospital due to an acquiring of an HAI. And the organisms that cause these infections can not only affect patients, but also healthcare personnel and visitors. So this is why people really need to be mindful of, even visitors, they need to be mindful that they're washing their hands when entering a patient's room and after leaving the room, and just taking appropriate standard precautions to prevent HAIs. So here are the Healthy People 2020 goals, and the current goals of Healthy People 2020 are to reduce central line associated infections, or CLABC, and to reduce healthcare associated, and I know this is a mouthful, methicillin-resistant Staphylococcus aureus, or MRSA. So these are the current goals of Healthy People 2020, but we also came up with our own goal of standard precautions and hand washing, and we also have some slides down below that you'll be able to see for that. So what causes healthcare-associated infections? So here we're focusing on MRSA versus CLABC, because that's what Healthy People 2020 are focusing on. MRSA is a bacteria that is incredibly resistant to antibiotics and may cause numerous types of infections, such as pneumonia, surgical site infections, and bloodstream infections. So since it is resistant to antibiotics, that's going to make it more difficult to treat, and that's going to cause the amount that they need to pay to treat MRSA. So, and then going into Class C, it's a life-threatening HAI that occurs when bacteria enter the bloodstream through a central line. These infections cost thousands of dollars per year and cost millions of dollars to treat. So it's taking millions of lives per year. Class C and MRSA contribute to that, and some risk factors are medical procedures, antibiotic use, and patient characteristics and organizational factors. So patient characteristics would be like if someone comes in, they're immunocompromised, maybe someone has cancer, they have diabetes, things that make them more prone to getting an HAI. And that's not their fault, it's ours because we're the ones that cause these. So we need to be taking precautions to prevent these from happening, to prevent lives from being taken.
Hey guys, it's Shani here. I'm just going to step in really quick to talk about prevention and a few ways to prevent HAIs from happening is through hand washing and education. Proper hand hygiene and infection control are really important to prevent HAIs, and utilization of PPE as appropriate to the situation, like gloves, gown, mask when necessary. Education of staff on standard precautions and safe handling of equipment and best practices. Education on procedures and surveillance of other members of the healthcare team to reduce the risk of infections involving sterile techniques, especially with catheterization or urinary decatheterization. While working with someone else and you see them break sterility, or you see a break in sterile technique, you need to notify them so that they can get a new pair of gloves or what have you.
Hi everyone, my name is Adaranki. I'm going to be talking about MRSA, which we all know as is methicillin-resistant Staphylococcus aureus, which is mouthful. MRSA actually is a bacteria that causes infection in different parts of the body. It is tougher to treat than most strains of Staph aureus or Staph because it is resistant to some commonly used antibiotics. The first report of methicillin resistance was in 1961. It is now known to be one of the leading causes of HIIs and community-associated infection. MRSA has a high incidence of mortality, which is why preventative measures are imperative to stop HII-associated MRSA. In 2014 alone, about 51% of the central line bloodstream infection were caused by MRSA. Acquiring this infection caused prolonged hospitalization and doubles treatment costs. There are several ways which MRSA can be prevented. There are some things that was highlighted on this PowerPoint, which are doing the MRSA risk assessment, education, monitoring programs, reporting, and accountability. Universal standard precautions like gown, gloves use, active surveillance and screenings, decolonization and hand washing, and some of the ways MRSA can be prevented. Utilizing these prevention measures is associated with a decrease in MRSA infections, medical costs, and most importantly, mortality. Performing screenings and assessment for MRSA in hospital admission increase the detection of MRSA, therefore isolating the bacteria. So this next slide is about ways we introduce antibiotics-resistant infection into the patient, and also ways we can prevent the infection in the healthcare setting. Surgeries and single-use catheters help treat patients, but they can also be pathways for bacteria to enter the body. Bacteria can spread when appropriate infection control actions are not taken. Antibiotics save lives, while poor prescribing practices puts patients at risk. prevent infections from catheters and after surgeries, plus preventing bacteria from spreading, plus improving antibiotics use. Okay, so this slide is going to test our knowledge of iodine. The first question is, what is MRSA? Is it a virus, a bacterium, or an antibiotic? I'm going to give you a few minutes. The answer is it's a bacterium. Next question, how do you catch MRSA? Options are by eating from dirty plates, from poor hospital hygiene, by drinking bad water. Got it. The answer is from poor hospital hygiene. And question 3. Which of these things has nothing to do with bacteria? 1. Wine making, yogurt, and the last one is common cold. And the answer is a wine making. Thank you.
Hi everyone, so this is Megan. I'm going to be talking about central line associated bloodstream infections. A lot of what I talk about is going to seem repetitive a little bit in comparison to what Adirondacki talked about with MRSA. So we're just going to start off here with the CDC reports about 30,000 of these bloodstream infections strike the hospital patients each year, and out of those patients, 1 in 4 will die from this infection. They're the most preventable in comparison to other healthcare associated infections like MRSA that we talked about. And it's really on the nursing staff and healthcare team to really prevent these infections. So we're going to get into that a little bit in the next couple slides. So this slide includes a video we found on YouTube. It's just on CLABSI. It's pretty funny. If you're familiar with the Johnny Cash song, you'll be able to sing along with this one. And it just talks more about central line associated infections and how to prevent them. So what is a central line? It's a catheter, as we know, that goes into a vein in our arm, chest, or groin. And it usually dumps into our heart or another large vein. We put meds and nutrients into this. We can take blood from it. There's a great risk here because of the portal of entry. We really want to think about those modes of transmission for infection, especially with the CLABSIs because of where they're located. We really want to make sure we're handling these with care, that we're wearing a mask when we're caring for them, we're using proper hand hygiene, trying to maintain this site really as sterile as possible, and that we're not leaving these catheters in too long, usually about 72 hours. There's different other reasons here that you can read about, but we really just want to make sure that we're preventing these with proper hand hygiene and maintaining sterility. Okay, so this is going to sound a little repetitive compared to what I just said, but we really want to emphasize the concept of prevention with these healthcare-associated infections. We really want to make sure we're using hand hygiene, chlorhexidine for skin prep, and we're using full barrier precautions. The face mask that I talked about, a cap and sterile gloves, and we want to instruct everybody that's around this patient to use the same barriers. And we also want to avoid the use of the femoral vein. The slide before mentioned that the subclavian does possess a little bit less risk, and that we're removing any unnecessary catheters. And again, thinking back to those modes of transmission, these catheters are portals of entry. So we really want to make sure we're preventing and really emphasizing this concept of prevention and hand hygiene and taking care of these appropriately.
My name's Shani, and I'm going to be talking about hand washing and education on
health-acquired infections. So the most important thing that we as nurses can do in the healthcare field is to wash our hands. So most importantly, some people may not know how to wash their hands effectively. So first you have to start off by wetting your hands, obtaining soap, lathering and scrubbing your hands for 10 to 15 seconds. So while you're doing that, you can sing the happy birthday song twice in your head. And then once that's completed, you can then rinse your hands. And then before turning off the faucet, you will have to grab some paper towels, dry your hands, and then turn off the faucet with the same paper towels to prevent getting the same bacteria and germs that are on the faucet when you first touched it. The goal of preventing health-acquired infections is to first educate staff on standard precautions through in-services, which I believe, or we believe, is the most effective way of preventing the infections. So standard precautions are infection control practices that are used to prevent the transmission of diseases that can be spread through bodily fluids, blood, and rashes. So these measures need to be utilized when providing care to everyone. Hand hygiene, personal protective equipment, needle stick and sharps injury prevention, cleaning and disinfection, respiratory hygiene. So we have to remember to cough into your elbow and not into your hands or into a tissue or something other than your hands. Proper waste disposal and safe injection practice. So doing all of these through in-service for those who are working in the healthcare field is the most important goal for preventing a health-acquired infection. Being educated on the importance of infections can help to reduce the prevalence of them. So having the education in the workplace creates a consistent awareness that infection needs to be prevented, and by using standard precautions does just that, prevent infection. Being educated on preventing infections through simple things such as hand washing and going over the proper techniques to wash your hands or handle body fluids creates a self-awareness. Education leads to awareness, safe practices, reduced infection, and healthier patients. Our end goal as healthcare providers is to provide a healthier state for the patients than which they came in. So providing these education awarenesses or in-services can help to reduce the prevalence of the health-acquired infections. Here is an example of standard precautions that we should be using on a daily basis while in a medical facility. A simple, consistent, and effective approach to infection control includes hand washing, the use of gloves, personal protective equipment such as goggles, masks, gowns, safe handling of sharps, so when we're done with sharps to make sure we put them into the sharps container, safe handling of waste, as well as soiled linen, and environmental cleaning. So doing all of these will help to minimize contact with blood and body substances by utilizing safe work practices and protective barriers. Here are our references. I, as well as my group, would like to thank you all for watching and listening to this presentation. So remember to always be self-aware, wash your hands, and prevent infection. As nurses, it is our duty to protect our patients from health-acquired infections.